So, uh, very good morning. Uh, so we started this. This is the first of its kind course that we've started in AIOC on, and I'm thankful to the committee for picking up this course on environmental consciousness in ophthalmology, and our role as doctors and what we are doing, and maybe what we can do in the next few years to get ourselves to get better and help the society and the system at large. Can I have the slides on, please? Slides. Yeah. So today we have four of us. We are all of us come from different backgrounds. I am second generation into private practice. Dr. Soumya has started a practice. Sabita has been running a practice in Pune, and Dr. Haripriya needs no introduction because she is running one of the largest high volume centers, providing guidelines not only to India but to the rest of the world. So it's very important for us to understand from each institute's perspective and each person's perspective. And this is not, it's not like we are authorities in this. So I would value anyone with any points to even break up in the middle and, correct us or let us know something, because I think this has to be a joint sort of a activity where we all have to move together in one direction. So we are a lot of eye doctors in one place. So AIOC itself published this data, the All India Ophthalmic Society, that they have 23,000 registered ophthalmologists. And there's going to be 25,000, let's say in 2020, so I'm guessing it should be about 27, 28,000 as of now. So it's a huge number of eye doctors that are there. And the number of, so this is just India, but we look at the number of eye surgeries done globally, there are about 26 million cataract surgeries being done, which is a very big number, so I had to put zeros so that we can get a perspective of what's happening. And so we generate a lot of garbage. And sometimes, or most of the times, for most of us, this garbage goes out the bin and we don't know where it goes and what happens to all this. I'm just going to very briefly talk, because this is going to be handled in detail. When we come to plastic, which is probably one of the biggest waste we generate, we decided to measure how much plastic we generate. So we saw that for 5 patients, we generate about 800 grams of plastic if we use single-use disposables for all our patients. Then we used ChatGPT to run an algorithm to understand what's going on. And this is what the whole, the complex mathematics of what happens when all the eye doctors in the world operate 5 surgeries a day, 5 days a week on an average, because some centers operate high volume, some centers operate low. What really does happen to all that plastic, and how much plastic do we actually generate? So to show you in perspective, if you pile up the plastic in 1,000 square feet area, which is the size of your clinic, it's going to go from Mariana Trench to Mount Everest every year. And that's the amount of plastic that we generate as ophthalmologists only. So forget about the rest of the specialities, because only eye generates this much plastic. So for the benefit of the 2 doctors that have just walked in, the amount of plastic that we generate as eye doctors is here. If you look at it, Dr. Vandana, you can pile it up in a year. Every year this much plastic we generate. We calculated it at Raghudeep, and all this plastic lands up in landfill and lands up in oceans and God knows where and all. Again, not all plastics are the same, and there are various classifications based on their biodegradability and compatibility and whatnot. And this is just to show you a cassette from one of the popular companies, Alcon. It says 6, we think it says recycled, but none of this plastic is recyclable. None of our packaging of our cassettes, cartridges, anything is recyclable, so it all goes into fill. And obviously we know where it goes on from there and where it goes. This is just to show you very dramatic picture that we saw on the internet, all of us must have seen. When it comes to air pollution, apart from doing whatever we are doing in the clinical work, the biggest source of pollution in our system right now is electricity. Because when we looked at it and we saw to measure a carbon footprint, which is going to be my next talk, this is how India works. This is data from 2023. 76% of electricity in a country like India now is still thermal. We talk of nuclear and solar and we talk of hydroelectricity, but nuclear generates only 10%. It's still 75-76% of fossil fuel burning and coal burning that we are using in our hospitals, at homes, to run our country, which is pretty alarming, because the government doesn't show out this data. They show the 2% or the 5%, but they don't show this magnitude of the problem. So we not only consume electricity, but to keep these things cool, we also use fresh water. So we use fresh water. 80% of the water used for cooling these thermal power plants is fresh water that goes into waste, gets into steam and gets blown out. So that's the amount of wastage that we're doing when we're doing electricity. And I think Dr. Soumya will handle how to conserve. But this is the problem. The other problem that we do, I mean, this is the major bulk of our air pollution, but then we also use a lot of gases, ETO being one, which can cause cancers and whatnot. So a lot of these countries have banned the use of ETO for sterilization for instruments because it's very heavily carcinogenic, and because we don't have any set methodology and any strict regulations looking at how to dispose or discard these things. One more thing that is very important is paper. Again, I'm not going to run you through the whole algorithm, but we looked at paper, 600 grams of paper per cataract surgery. If we use single-use disposables that use packaging that we're opening, gloves, whatnot, and if we compile it all together and lay down this thing, we are going to fill up this entire perimeter that encompasses the entire lot. I don't know if you can see this here, but this is the Biswa Bangla Convention Center, and it converts the entire block will cover up in a year. This is the amount of paper we consume as cataract specialists. Only cataract, I'm not talking any other surgery. So it's very important that we be very judicious of what we use when it comes to this. And we'll discuss this again, but right now it's very important for us to primarily, if at all, we as ophthalmologists, we can see there are 6 people in the hall today, but hopefully next year there should be 10 and then 15. And if we just understand the magnitude of the problem, then the solution is pretty straightforward. But to understand only will be the biggest challenge. We are polluting water by doing our laundry. We are doing a lot of washing and we are throwing this off. And apart from this, a lot of chemicals, a lot of these, I mean, this is not necessarily from ophthalmology, but a lot of infection also does get washed out because there is no stringent rules and regulations, particularly for small clinics and small hospitals for sewage and hospital wastewater management. Again, this is the same thing. So I think it's very important that we open our view into a little broader perspective, starting now, because someone has to be a catalyst of change. And like we said, we are so many of us. This is how India stands right now from a global perspective. We are 112 in terms of our ranking for sustainable development out of 166. So we are right down there. We are nowhere up, and it's unlikely that we'll be up in the near future because of the problems there are. But it's also because although the government is making efforts, the level of commitment to the programs that have been started and the efforts that are being done are fairly low. They're not looking at a follow-up and they're not looking at a feedback loop. So they're just coming up with incentive strategy and they're giving up strategies on this thing, but they're not finishing the loop by making sure it's implemented on ground. So I think it's very important for us, to be as doctors, as ophthalmologists, to at some point, or as general human beings, to have a certain level of commitment to our environment and to our immediate environment. And I think with this course, we'll be able to come up with certain strategies that will help us in at least getting ourselves tuned to the idea of sustainability. Thank you. So